You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He's a board-certified prosthodontist. With us, we have Dr. Nate Farley. Dr. Farley, welcome to the program.
Oh, thanks for having me, Randy.
Good. And I know you brought a lot of photos, so we'll try to get to as many of those as possible. I mean, you have stacks of these photos.
Yeah.
Now, for people that don't know you, who's the typical patient that's coming in for dental implants?
Right. I don't know if I could say we have a typical patient, but our patients definitely fall into two different categories. One of those groups is somebody who has teeth still, but they've kind of spent their life dealing with problems with their teeth. They have gum disease. Their teeth are starting to shift around sometimes because of that gum disease. They are dealing with cavities and bad breath. So that's kind of that first group. It's failing. I guess you call it a failing dentition. So those people come to us because they don't want a denture. They want new teeth. And we're able to give them that, something that's not a denture.
Is this true, like in certain cases, people can walk in on the day of the procedure with a denture and they walk out with a brand new set of teeth that don't come out?
Oh, yeah. Yeah, we do that all the time.
Is that common or rare?
Oh, in our office, it's common.
Okay.
I guess in some other offices, they don't do it at all. They don't offer it. The second group is patients that are already wearing a denture, but they're kind of out of the system. We don't see them as much. They're not thinking about their different options, but these are people that we could help the most.
Okay, good. Now, are there a lot of people in Arizona wearing like an upper lower denture or missing 9 or 10 or more teeth?
Oh, yeah. Tens of thousands. Of thousands. You could fill a stadium with the amount of people that are wearing either one or two dentures.
So it's a big deal. So if implants are so good, why aren't they all doing it? Why aren't they all coming in and saying, okay, I want a new set of teeth supported by dental implants?
Right. What's
your take on it? Why aren't they doing it?
So there's a lot of reasons that somebody's not going to just be flooding our office asking for dental implants. One of them is that these are people that, like, for example, they are already in a denture. And if you're already in a denture, you are already comfortable, I guess you could say. You've adapted to what you have. You might not like your denture, you might hate your denture, but you know that you have a denture. And so you've kind of been out of the system for a while.
So nobody's suggesting they do it?
Right, yeah. And if they did have a problem with their denture, they went to their dentist and had something adjusted. Maybe they was suggested a reline. So they just went along with that, but didn't get offered something more, something better. So let me tell you about your life a little bit. When you are wearing a denture currently, you have already been through a journey to get you to that point. You maybe at a young age dealt with a lot of decay, and that decay turned into a lot of fillings. And as the decay process progressed, you're looking at crowns, root canals, failed root canals, extractions, bridges, partial dentures. You've already been to the dentist so many times.
There's a lot of money too.
Yeah. Frustration too. You know, to have everything fixed and then 6 months later, somebody says all your problems are back. And then it happens again and again, and you feel like you're constantly chasing. Some of these people, by the time they get into a denture, they're almost relieved that story's done, that part of it is gone and behind them now. But now and like I said, they might not like that denture, they may hate that denture, but they at least are feeling,
adapt, I guess.
Yeah, they at least are glad that they're not dealing with teeth and the pain that comes with teeth that need root canals. The second reason is that people are looking at things like, I'm too old for this.
How old can you be to do this?
There's no age limit to how old you can be.
What's your oldest patient?
He was mid-90s. He had implants.
Why would a 9-year-old want to do this?
Because he wants to eat. He was the most jovial guy. He's the guy that you hear him laughing coming down the hallway. He's not slowing down at that age. He's out dancing, and he wants to be able to enjoy life. And so when he has failing teeth, he doesn't want to deal with something that's going to slow him down. He wants implants.
So if you're 90 years old, aren't the implants more likely to fall out?
What do you mean?
It seems like if you're that old.
No.
So it doesn't matter age.
Age, there is nothing in the research.
So 75 is young to get this done.
Yes, definitely.
What if you're on medications? Like, everybody, look, if you're 75, a lot of them are on 4 or 5 medications.
Sure.
Do you work with that? Work with their doctor if you have to?
Yes. We can get approval from your doctor to make sure that there's nothing in your medical history that's preventing you from getting dental implants. But the truth of the matter is the truth of the matter is that there are very few contraindications in one's medical history to getting dental implants.
Yeah, but what if you have bad gums? Can you still do this? Are your gums good enough to get the implants?
Yes. So gum disease is a disease that happens as bacteria is forming around your teeth, and it's going deep down in the gums. But when you go through this procedure, the teeth are removed, the gums are cleaned up, and heal quite nicely in the area, so that you're not dealing with that same gum disease that you have.
So this breath, I mean, when you have bad teeth, you get bad breath. I mean, what's the source of that?
It's the bacteria. Yeah. When you're looking at gum disease, the source is bacteria. When you're looking at decay, the source is bacteria. Bacteria make a bad smell, a really bad smell.
So the odor goes away when the teeth are extracted?
Yes.
Okay.
But back to your original question, why isn't everyone in town coming to see us for this procedure?
Yeah.
Okay. Expense is something that most people are concerned about, because what they're doing is they somebody told them what the cost of one implant's going to be, and they're timesing it by how many teeth they know they need to have, and the numbers get too big. And the reality is it's not that way. You know, when we're doing these procedures, it's one procedure, not 28 procedures. It's let's get you as few as 4 implants and get teeth on those 4
So
implants.
like a full arch of teeth on just 4 implants?
Yeah.
In certain cases?
Yeah.
Okay. So what about pain? It seems painful.
Right, yeah, you would think. Any surgery you're going to think is painful. It's not really as much of a concern as you think. And an example I would just to throw out there, we had a patient that chose to not do sedation with us.
Okay.
And she asked for a mirror during the procedure, and she just sat there and watched while we were doing this procedure because she was interested in seeing what was going on. But going back to what you said about
So they're all numbed up. I mean, during the procedure, they feel nothing.
No, we get you very numb. But a lot of people do want sedation. A lot of people don't want to be awake for the procedure. So you're monitored, you're watched, you are given medications. And I mean, some of those medications make you forget everything that
That's what I heard.
happens.
Like they don't remember that they had it done.
Oh yeah,
really?
It's great. And then for those that don't want sedation, it's an option. But you're always gonna be
numbed
numb.
up.
You're always gonna be numb. You're not gonna have pain.
Okay, good. Now you say this is life changing, and you brought some photos. Let's take a look.
Okay, this one for example.
Okay.
So if you look at the before photo of what she is dealing with, we have patients like this all the time. Patients like this are coming to see us because they are having pain from gum disease. They're having pain from tooth decay. Teeth are breaking off because of the amount of decay that they have. They've already been through it. They've had root canals. They've had crowns. The crowns have failed because of the decay. And you can see in this particular patient, she's lost a lot of teeth.
Now, when I look at that, that's got to be unusual.
It's not as unusual as you might think. We see this all the time. People coming to see us because everything is falling apart. And these are the people you almost get most excited about, because these are the biggest transformations. When you can take somebody who has this much wrong and you fix all of it. All of it is just gone.
Nice.
And everything new is put right in that.
So these people never smile. That's why you don't see it.
No. I mean, this photo we have of her smiling as the before, that's forced. You know, that's us saying, no, smile bigger. Come on, bigger. We need you to smile. We need you to laugh, because we're trying to get them to smile, but no, they don't want to smile. So when we're talking to these patients about options, you know, they know that the option of a denture, they know that that's something, but many people, this patient included, does not want to deal with that denture just floating around in their mouth. They know, because maybe they have family, friends who have a denture. They know what it's like. They don't want that. They want to live their lives. And so we presented them the option of implants. And this is what we gave this patient.
Looks good.
We're able to take
younger.
out the teeth for implants and then have teeth on implants. And yes, if you compare the before and the after, and if you, Randy, looked at these side by side, you can see the difference. It doesn't take a lot to be able to notice that, hey, between here and here, she looks younger. Mm-hmm. She looks more confident.
Yeah.
If you look at her smile after the procedure, you can see the nice curve, how it follows her face. It is life-changing.
It changes, when we talked on the phone, it's like people, I always feel like dentists are exaggerating how it changes your appearance, but it really does.
Yeah.
I mean, it almost doesn't look like the same person in a way.
Right.
It's just teeth.
Yeah. It's amazing how much a smile can change somebody's entire appearance. And so, I mean, in the patient that we were just looking at, big example of how you can put a smile in somebody and change their appearance instantly. All right, so this is another gentleman, and the interesting thing about this gentleman is that he came to us. You can see from the photos, similar to the last patient. A lot of missing teeth. Teeth are broken down, has periodontal disease, decay, has it all. Has already been to the dentist year after year after year. He's tired of it. He's tired and was looking for a better solution. So the thing that is interesting about this patient is we presented him with all the options. And he first had the implants placed on the lower jaw and had a denture on the upper jaw. And about 2 months later came back and said, can I get implants on the top as well? And we're saying, well, yeah, of course you can. Do you not realize we talked about that?
Yeah.
And then he ended up going with the implants in the upper jaw as well. And so now, as he's gone through both of these procedures, now he's in a situation where he's a different person. And you can look at this and you can see, looks younger, looks more distinguished.
Even more educated.
Yes.
Just because of the teeth.
Right. And on top of all that, you can eat whatever you want. I mean, how much of life is food? What do we do in any culture you look at worldwide? Holidays come around, what do? We cook and we eat. If we get together with friends, what do? We go out.
Can they eat chewy things like a pizza or like bite a raw carrot with their front teeth?
All of that.
Really?
All of that. Whatever you want.
No restrictions?
No restrictions.
Did they tell you eating stories? Did they tell you eeating stories?
Oh, yeah. Yeah. No, patients.
Did they ever call you and say, hey, are you sure I can eat already?
Right. It's a fun ride to be on with them. I will say that. Just to see that difference in how they're used to living their lives and to see them learning again, I guess you could say, learning again how to be able to enjoy life again.
But you say sometimes, and we were talking in the green room, that sometimes they come in on the follow-up, you don't even recognize them.
Right.
Like they act differently.
Oh, yeah.
Really?
Oh, yeah. Yeah. I mean, if you think about it, a lot of these people are coming in, and the first time we see them, they're already not smiling. They're already not convinced of what's possible, and they don't know what can be. It's kind of like we talked about earlier. We get excited because we know what's going to be different for them. We know how life is going to change for them. They don't know that yet. And so after they go through the procedure, when you see them again and they're smiling and they're flirting with the front desk and they're living a different life now, and they recognize it. And they didn't know that was possible before. They knew they wanted, their teeth to look nicer, and they knew they wanted to be able to chew things maybe that they struggled with. They wanted to be out of pain, but they didn't know their whole life had the potential to change like that.
So this guy in particular would have had a denture. I mean, that was his option, denture.
Yeah.
And now he has teeth that don't come out.
Right.
And did they just get them cleaned like regular people? Like every 6 months they come in for cleaning?
Yeah, more like once a year is enough. But we have a hygienist. And these patients come in and have their teeth cleaned by that hygienist.
Okay, good.
So this next one I want to share with you.
All right.
She is just one of the sweetest girls I've ever met. She was born with a syndrome called EEC syndrome. And as you can see in the photos, it affected more than just her teeth. She has bilateral clefts going through both the lip and the palate. She also has ectodermal dysplasia. And with that, you lose a lot of your permanent teeth. So she's missing a lot of teeth. The teeth she has are worn down. She didn't come to me because she has decay or gum disease. She doesn't have those two things, but she's missing a lot of permanent teeth and has clefts, which are preventing her from being able to do all the different options that are available for her. With her, we were able to keep some of her lower teeth, but all of her upper teeth had to go, and about half of her lower teeth weren't something we could work with. So we kept some of the lower teeth and got some single implants down in there, but in the upper jaw, we were able to give her a full set of teeth on 6 implants.
Nice.
Yeah. And
she looks happy that after, that's for sure.
It's amazing. It is, and if you're looking at this girl, she's young. This girl is in high school and comes to us. And I mean, I don't want to say I made her not shy anymore, because she came to us, wouldn't say a word. Very shy, very reserved. And you can see in the photo at the end, you can see more confidence. You can see that she is starting to feel like she can interact with people, smile, talk, and it's life-changing. And keep in mind, she would have ended up in a denture. And in our office, no more dentures.
So you could wipe out dentures in Arizona, possibly, if they let you?
Right.
So your goal is not to put anybody in a denture if you don't have to. Is that right?
Of course. Nobody should live their life with a loose denture.
Okay, good. We're going to take a quick break. We come back. I know you have more photos, so we're going to kind of rush you when we come back because we're short on time. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back.
It had just gotten to a point where I wouldn't smile at all. It was mostly semi-embarrassing. The procedure I got was both upper and lower. These are basically screwed into place so they don't come out.
I can eat anything I want, and you make the top ridge work with the bottom ones so that my bite is perfect. My teeth are not holding me back anymore.
I had full dentures, and the only way I can describe it was a nightmare. And they suggested that I have implants. It was 99, almost 100% better it was 100% better from what I had before, but almost 99% normal eating. I put in the upper denture and it stayed, no glue. And I was able to actually eat sandwiches again and a salad. I hadn't eaten a salad in years. All in all, it's been a fabulous experience. And I would say anyone, do whatever you can to get this done.
I had my top teeth all capped and they went rotten underneath. I had no alternative except to have them pulled and go for dentures or implants. Yes, this all-in-4 procedure has changed my life. I'm just so much more at ease because I know I can eat, I can smile, I can feel good about myself. I don't have to worry about teeth falling down if I smile or if I don't have the glue in to hold them in. And it's just been a wonderful experience.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. Dr. Farley here says nobody should be wearing a loose-fitting denture. Okay, so you believe that?
I do.
Like, is that the future, though, of dentistry? Like, dentures as we know them today, maybe it's 100 years, but dentures will always be attached to something?
Right.
Do you believe that'll happen?
I think one day we'll get there. Well, I hope that one day it's the standard of care. That when you lose your teeth, that's the next step. That's your third set of teeth, is teeth on implants.
Third set. You got the baby teeth, the adult teeth, and now these.
Implant teeth.
Okay, good. Now you have more photos. What are we looking at?
I do. Really, really nice lady. The interesting thing with this patient is it was actually her husband and her both came to me, both with failing dentition, upper and lower teeth, but the husband said, you can go first, hon. And so we were able to take out her teeth, and she did not want a denture. She did not want a denture. She got implants on the top and the bottom, and
look at that after. That's a beautiful smile.
Oh yeah, just a fantastic transformation for her. But Randy, look at the side by side.
Okay.
Notice how much of a different person she is, just in her eyes. You know, how her eyes are lit up between those two pictures. Just imagine how you're going to feel when you can smile and have that kind of a smile to show people. And
it looks real.
Yeah. Oh, yeah.
I'm not trying to side with you.
No.
You know, it's like, but I feel like I could spot fake teeth walking down the street 10, 20 yards away.
Some you can. Not these.
And these look pretty. Yeah, these look good.
They look very real.
And so, what do they like more? What they could eat? Because I know salads they could eat again. But do they like the eating part, or they like the way it looks?
Well, I would say that you always, when you're starting with somebody, they always say, this is my concern, my main concern. I've had plenty of guys come to me and say, I don't care what the teeth look like.
Okay.
I just want them to be strong, and I want to be able to eat with them.
Okay.
And yet they're the ones that, as you're going through the process, you start realizing they do care what it looks like. They do want it to be a bright white smile that they can, you know,
You say they're taking selfies, they're
Right,
Insta models, and
yes.
aggravating all their friends with all the photos of themselves.
Why not? And so yeah, I mean, everybody, whether they know it or not, people want to look good.
Okay.
And they want to chew, and they want to be pain-free. So this next picture, this is a patient that Dr. Howell, my partner, worked with, and the I guess you could say the heartbreaking story behind this gentleman is that he neglected his teeth for a while, but it's because he was caring for his wife. His wife had terminal cancer, and for the last years of her life, he didn't want to focus on himself at all. He wanted to focus on her. And when she passed, he mourned the loss for a while until he realized that that is not what his wife wants him to do. His wife doesn't want him like this. If you look at that smile, he wanted something better, and he knew that she wanted something better for him. And so his option, dentures, right? No, we're not doing dentures. He had implants placed and teeth supported on those implants. And you can see very, very clearly when you look at that before photo and that after photo, how much better life is.
He's back. He can eat whatever he wants.
Right.
Like even like a steak, like a thick.
Oh yeah.
What about nuts? You can eat nuts?
Yes.
So it doesn't really matter.
Anything. Yes, correct.
Just, you don't want to chew ice or things you do with your regular teeth anyway, right?
Right. No, but I mean, the foods that people love that they just can't eat with a denture. Raw vegetables, Let me show you the next patient. This gentleman, he has become a really good friend of both mine and Dr. Howell's. We worked on this patient together, okay? And you're looking at a guy that came to us who had been without teeth for a very long time. He had no teeth, no denture.
Wow.
And
how does he eat? Just kind of rub your food together. Okay.
Yeah, just eat. I mean, you're limited. People in a situation like this, these are people that they still want to eat out, but you get to the restaurant and you look at the menu and you have to be selective. You're not going by, hey, what sounds good? You're looking at it going, what can I actually eat with my gums? Or if you had a denture, what can I actually get through with a denture without having to excuse myself to go clean things out? So, I mean, you look at this guy, and the thing that we love about him is he came to us in a position in his life where he's putting pieces back together. He and his wife, they are working to get things back in line, and this is just part of that puzzle. Wow. He knew that he needed to have something to go get a job, just to be able to show up at an interview, to have teeth in your mouth so that you're presenting your best self.
Is this one of those things where they say I should have done this years ago?
Oh yeah. Oh, everybody believes that. Before. Everybody believes that. Everybody who has it done, because most people they're hesitating. Okay, most people are hesitating, and they're waiting for something. Okay, they know that they're in a bad place, but they're delaying. They're delaying. Either their teeth are failing more and more and more, and they're just delaying. And then when they finally decide, you know what, I got to get this done. They get it done. What's the next thing that comes out of their mouth? Why did I not do this sooner?
You say they look at the mirror when it's all done sometimes, and they get choked up.
Oh yeah, all the time. All the time. I might get more choked up. No,
like your assistants. I mean, everybody. It's an emotional situation, I guess.
Oh, a lot of tears. A lot of tears from the moment you hand. I mean, and sometimes the emotions start when the spouse is looking at that new smile, and the spouse is starting to cry.
Wow.
And then the patient is handed the mirror. They start to cry. I'm starting to cry right now just thinking about it.
Okay, well, we won't let you cry. Now, we are really short on time.
Well, let me just show you just a few more.
Two more.
So this gal right here, she came to us with a denture that she hated. If you look at that smile, before and after, side by side, you can see that one of them looks like her smile's upside down. Her back teeth are hanging down further than her front teeth. And you look at the after, and these are teeth on implants. She has confidence. She can smile big. That smile is following the lips. Beautiful. This next one, this is a gentleman, just blue collar guy. He's a handyman in our area. His wife dragged him in because he's complaining and she doesn't want it anymore. She brings him in. You just look at the before and the after. Wonderful. The next
Wow.
one.
I mean, he looks like he could be a lead actor in something.
Oh,
He
yeah.
looks very sophisticated
Oh, yeah.
with those teeth.
I know,
they're
and
not
he's
big
got
and
the
bulky.
hairstyle too.
And they're not big and bulky. I mean, it's looking good.
They look fantastic. The next one, she came to us, and this is one of those smiles that we had to beg for. When the before photo, we begged to get that photo.
She didn't
in.
want to smile, is what you're saying.
She did not want to smile. She
Okay.
was saving her money for a time. She wanted to go to a place that she had felt confident with. And you look at the after photo, 2 days after
Wow.
the procedure. We had her back, took this photo 2 days after she was done. And you can see how much of a difference that makes. And just maybe 2 quick ones. This gentleman, before and after, you look at the before, you look at those teeth, how they're overlapped. He's missing a lot of his teeth. You look at the after, confidence.
And those
He
would have
can
been
chew.
dentures. This
And
guy
they
would have been
dentures.
dentures. Okay.
Oh yeah. And then this last patient here, she started in a denture.
She looks happy.
Same as the other patient. You look at those teeth before, and it's like an upside down smile. You look at the after, she's beaming.
Very
beaming.
nice. Now, we have to mention, dental insurance doesn't really cover implant dentistry. Only, like if your max payout's like $1,500, that only covers a small portion. Medicare definitely doesn't cover it. Medicaid doesn't cover it.
Right, but we have financing. We have the ability to help somebody through this. If your credit is good, we work with many different vendors that can help you get
Do they
through
finance?
this process.
Is this common that they finance it?
Almost everybody finances it.
Oh, really?
Yeah,
Okay.
it's very common.
We are out of time. Now, you're a board certified prosthodontist,
Yes.
right? Do you have a bit of a bias? Like if you're going to get this done, might as well get it done with a prosthodontist?
Well, yeah.
Okay.
So I have extra training. I do things different, and we give all the different options.
Okay.
Some of the bigger centers out there, they may have one option for you. Everybody just gets.
You
fixed
also
teeth.
offer, we didn't talk about this, but you offer the snap-in teeth,
And that's
snap-out,
what I was getting at.
supported by implants?
Exactly. That's what I was getting at. We offer the fixed option, and that's what I would want for these patients. But we also do the snap-in, snap-out denture. It's a less expensive option. And the thing that I like about it, if done right, you can upgrade. One day you can add just a couple more implants and get fixed teeth.
Okay, and you guys do it all in one place?
Yes.
Like typically it's done, you go to one place for this?
Right. Surgery is done. The teeth are designed. The imaging is done. We have an on-site lab.
All right there.
Gobs of technology. We build everything right there in the office.
On-site lab. When were you going to tell me about that? Okay.
Oh, yeah.
You have it all right there. Look, pleasure to have you in
Yeah.
here. And also, in your practice, we should mention, you have a partner that works with you.
Yes.
And we're also going to have them on the show.
Right.
So whether they deal with you or everybody has
Me,
similar
Dr.
training.
Howell, you'll love either of us. We're really nice guys, really approachable.
Okay, good.
And we go way back. Dr. Howell and I did our training together. We've known each other for a very long time.
Okay, good. I want to thank you again for coming on the show.
Oh,
Good
thank
stuff.
you. Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you could help.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.